I am Paul Oberstein, Director of Gastrointestinal Medical Oncology and Assistant Director of the Pancreatic Cancer Center in the Perlmutter Cancer Center. I treat patients with different kinds of gastrointestinal cancers, including colon cancer, liver cancer, stomach cancer, and especially patients with pancreatic cancer. Partly because of my interest in scientific application into medicine, I became very interested in oncology, which is a field in which we've made rapid scientific advance in the last 10 to 20 years, and there have been numerous opportunities to use those scientific ideas to improve treatments for patients. One of the things that are very important in our practice is to enroll patients in clinical trials, and so we're involved in treating patients who have opportunities to go on clinical trials. We're constantly looking for clinical trials and developing our own clinical trials, and our goal is to provide as many clinical trial opportunities for patients as we can. Perhaps the most exciting area in gastrointestinal cancer research is the advent of the availability of immunotherapy to treat these cancers. Although, unfortunately, immunotherapy to date can only be used to treat a small number of patients with GI cancers, we're hopeful that that number is growing. And we've seen examples where patients had very advanced disease and had dramatic benefit from immunotherapy. Our hope is to use those examples to apply it to a much larger number of patients. And we have many active ongoing clinical trials testing immunotherapy for patients with pancreatic cancer and other GI cancers in order to make that treatment available to more people. One of the things that drew me to pancreatic cancer was the really difficult situation that currently exists. Unfortunately, it's one of the most difficult to treat cancers in the United States, and that hasn't changed in many years. There are many people working on understanding why that's the case, and I thought it was a really wonderful opportunity to take some of that work, see how we can apply it into patients, and really make a difference where it's needed.